The two most common lifts used to move patients in hospital and home care settings are overhead lifts and floor lifts. Floor lifts are much harder to use than overhead lifts because 1, they required more effort to move, 2, the pulling of a lift, usually in a confined space, requires a lot of twisting, straining, and pulling, 3, using only the handles places the caregiver far away from the center of rotation of the device. 4, in the home environment, floor lifts are particularly dangerous as they're often pushed over carpets, through thresholds, and doorways. If a healthcare worker needs to use a floor lift, here are some tips that can help prevent back injuries. 1, when turning the lift, push or pull the boom from the top. This gives the operator more leverage, making it easier to move. 2, push the base or forks of the lift with a foot to get the device moving or get more leverage when turning. A better alternative to floor lifts are overhead lifts, which run on a system of tracks above the patient's bed. These lifts are safe and easy to use and greatly reduce the risk of injury for healthcare workers. While an overhead lift is preferable to a floor lift, both lifts still present risks when moving a sling under the patient in preparation for transfer. Most use the log roll method to safely unfold the sling underneath the patient. This action requires the caregiver to maintain a bent posture for a long time, increasing the risk of injury, particularly with bariatric patients. To solve the log roll problem, researchers at Toronto Rehab have developed Sling Serdar. Sling Serdar is an easy-to-use tool that effortlessly inflates a series of lifting straps under the patient, greatly reducing the risk for injury. Once the straps are placed under the patient, they can be attached to an overhead lift, which gently raises the patient a few inches, making it easy to insert the sling. Having the patient elevated also gives healthcare workers the opportunity to insert a bedpan, change sheets, or reposition the patient as needed. Sling Serdar is just as easy to remove. Just pull the exposed end out. It's designed with the patient in mind. As you pull, Sling Serdar turns inside out, so there isn't any friction or discomfort from the straps for the patient. Using the right tools with Sling Serdar can make lifting and transferring patients easier and safer, reducing the risk of injury to caregivers. For more information, visit preventbackinjury.org.